Just ahead on Washington to Washington.
Fentanyl is in abundance. It's everywhere, it's cheap, it's plentiful, and it's causing so many more overdoses.
A nationwide crisis.
Fentanyl is a killer that we're just letting run rapids in our streets, in our homes, in our schools, and there's no stopping it.
The death toll from the synthetic opioid fentanyl continues to climb.
It just seems like a change from heroin over to fentanyl, and when you went to fentanyl, it became much more lethal, so the overdoses went up.
As the debate over how to address the crisis plays out in Washington state and in the nation's capital.
We also have to invest in long-term recovery. This is beyond 7 days. This is beyond 14 days.
We've got a big job to do of educating young people, parents, the entire community as to what's going on here.
Federal agents track the deadly drugs path, from the chemicals shipped from China to the cartels in Mexico moving thousands of pills across the border.
DEA works everywhere. We work overseas, on the border, where all the states where the drugs are passing through.
And the demand to treat those addicted in cities and towns across the country grows.
We are trying to meet the need of our patients to the best of our ability.
From the capital of Washington state to the capital of the United States, this is Washington to Washington. Hello and welcome to Washington. I'm Jennifer Huntley in Washington State. It is one of the most challenging issues facing communities today, the fentanyl crisis. In hospitals and healthcare settings, fentanyl is a synthetic opioid 50 to 100 times more powerful than morphine that is used to treat severe pain, typically from late-stage cancers. But on the street, illicit fentanyl is a cheap, deadly drug that has replaced heroin and prescription painkillers. And as you'll hear, just one pill can kill. Here in Washington state, the crisis has been swift and deadly. In 2019, 337 people died of a fentanyl overdose. Just 3 years later, that number jumped to 1,850, a nearly 450% increase. The numbers continue to climb with recent data from the Centers for Disease Control, ranking Washington state 8th highest in overdose deaths per capita nationwide. So what should be done to change the course of this crisis? Well, we talked to state lawmakers and members of Congress, the U.S. Drug Enforcement Administration tracking the cartels in Mexico, experts working in treatment, and those in treatment themselves. Over the next half hour, you'll hear from them as we ask the question, what will it take to get a handle on the opioid epidemic? But first, we hear from a mom who is sharing her story so that others don't have to feel her pain.
Lucas was, he was like a comedian 24/7.
Maria Petty is like every other mother. Ask her about her child and she can describe him to a T.
Everything was a joke for him. He was able to laugh and find humor in all things, even when he was in trouble.
Along with making people laugh, her 16-year-old son Lucas loved animals.
There wasn't anywhere we would go that he wouldn't find a garden snake or a creature or a stray animal.
In the summer of 2022, he got his first job as a lifeguard at a local pool.
He loved that. He loved helping people.
It was also the summer that he smoked pot for the first time.
At that point, we did not know that the pot he had smoked was laced with fentanyl. Come September, he was pretty ill all the time.
Maria and her husband took their son to the doctor to get answers.
He was so ashamed and so embarrassed himself. He was a wrestler, he was a good kid, and that wasn't him.
They took him out of school and homeschooled him that fall. They locked down their house, all in an effort to get him better.
The 30th of October was just another Sunday. We had dinner and Lucas and his sister watched a scary movie up here, and my husband and I watched our show downstairs, and bedtime came and everyone was supposed to go to bed. His uncle stopped by to drop off a costume. We have a Halloween family dinner every year, and so he dropped off a costume. I came up to check to make sure the door was locked, and I went to his room. He was in his costume doing a TikTok. "Damn it, Lucas," was the last words that I said to my son. Well, he was alive. He jumped back into his bed, laughing, and said, "Sorry, sorry, sorry." And I went to bed. The next morning was Halloween, and I had overslept. So I was rushing to get the kids out to the bus stop and then get Lucas up to get started on his school. When I got home, he wasn't responding to me yelling. I went into his room and he was laying there like normal. He had his Broncos blanket on. He had his foot sticking out of the blanket and his window was open. And it was at that time that I grabbed his foot to shake it to wake him up, and it was cold.
Maria gave him 2 cans of Narcan, the medication used to reverse an opioid overdose, and started CPR while on the phone with 911.
I continued the compressions until they got here to relieve me. I remember the paramedics came in and there was 3 of them, and the younger one, I remember he got down and he shook his head and the older one, he looked at me and I'll never forget his look. It was like he felt so bad for me. He instructed them to keep going. And they asked me to leave the room, and so I sat in the hallway. They came out and helped me to the couch. And then the older paramedic let me know that they did everything they could, but he was gone.
After Lucas's death, Maria wanted to warn others of the dangers of fentanyl.
Lucas loved his family with a love that was so pure and unconditional.
She visited high schools with the Federal Drug Enforcement Agency, telling her story, including the details of finding Lucas.
At 7:24 a.m., I yelled out to God, "Please take me instead. Please let me save my son."
Why do you think this information hasn't been out there before?
It's that stigma that the schools, it's not a problem because we're in a good neighborhood, we don't have like bad kids. The majority of our kids aren't, we would know, right? You would know, but you don't know, and it's everywhere. And fentanyl is not discriminating, and it's taking people as fast as it possibly can with no warning.
She met with her son's school, her state representative Mari Levitt, and Governor Jay Inslee. And on March 19, 2024, she watched as Inslee signed the Lucas Petty Act.
With this, we want to thank sponsor Representative Levitt and Senator Wellman, and I'm happy to sign this legislation. All right.
A bipartisan bill that adds opioid awareness to health education courses in Washington state.
Had my son survived October 31st, 2022, he would have been out there telling all of his friends and everybody. And I want to honor him in that way. And I want his name to not just be someone that died due to fentanyl. I want his name to be what fights fentanyl and what prevents maybe another family from having to lose a child, having kids lose a friend.
As the crisis grows deadlier by the day, there is bipartisan support from the Washington State Legislature for education, not just with students, but all Washington residents. Noting that Washington State's overdose deaths were the fastest growing in the nation.
Remarks, Senator Wilson Linda.
Republican State Senator Linda Wilson sponsored a bill for a statewide overdose prevention and education campaign.
They've got to start learning about this because across the country, we are losing 100,000 people in overdose deaths a year.
How is this different from the 1980s campaign of just say no to drugs?
Well, you have a lot of kids out there that are taking other drugs, other pills, and thinking that's what they're getting, and it's laced with fentanyl, and they have no idea.
Senator Wilson sponsored another bill that would make it a felony for an adult if a child is injured from ingesting fentanyl while under their care.
A 1-month-old baby was lying on the front driver's seat, face down between the seat and the mother's leg. The baby couldn't even open her eyes because she had so much fentanyl in her system. And she tested positive for fentanyl. She did live, but barely.
The measure passed with support from both parties in the Senate,
Mr. President, there are 48 yea, 1 nay.
But never made it out of the House, with Democrats reluctant to add more penalties for parents addicted to drugs. How much support should go towards treatment versus holding those accountable for having drugs in possession and access to children?
You know, that's the issue here. They do need treatment, but fentanyl is like 50 to 100 times more potent and more addictive than any of these other drugs out there right now. So parents that are addicted to fentanyl are they're gonna have a tough time getting off of that. So in the meantime, these kids are left in their care.
The legislature ultimately added more money to the state budget to pay for opioid treatment and behavioral health programs.
We also have to invest in long-term recovery. This is beyond 7 days. This is beyond 14 days.
Representative Deborah Lekanoff and other tribal leaders pushed a plan called Heal One Washington, specifically aimed toward tribal communities that have been hit hard from the epidemic.
Addiction hides behind so many doors, Madam Speaker, that none of us are even aware of it.
In 1 week alone last September, the Lummi tribe in northwestern Washington lost 5 community members to fentanyl.
Coming into this legislative session, it's been a journey of healing myself. I am just celebrating my 8 months of sobriety at 53 years old.
Representative Lekanoff, who has spoken publicly about her own treatment for alcohol addiction, sponsored proposals to streamline the licensing for Native American healthcare providers and expand state funding for tribal treatment facilities. Native Americans and Alaska Natives in Washington state die of overdoses to fentanyl at 5 times the state average.
Addiction runs rapid, I think, throughout Washington state, and we just haven't seen it clearly. And for me, walking this pathway of being an experienced person who is healing every day, I'm healing with One Washington. My policies that I've focused on this session are oriented specifically around prevention, medicated detox, recovery, and also the aftercare.
Okay, we're here for House Bill 2075.
About $8 million a year will go to the 29 federally recognized tribes in Washington state. It will help fund treatment programs, many already established by the tribes, that also serve non-Native community members.
Happy to sign this bill.
The money comes from the nearly $500 million in settlement funds between the state and major opioid distributors. While tribes have opened opioid treatment clinics in at least 8 locations statewide, with more planned, it is clear the state needs more help in the area of treatment. 25 of Washington's 39 counties are currently without an opioid treatment program, which provides daily medication and counseling services. Medication-assisted treatment is key to effective opioid addiction treatment. There are 3 primary medications: methadone, buprenorphine, and naltrexone. Programs that administer these medications must be licensed by both the state and federal government. In Mason County on the Olympic Peninsula, overdose deaths have skyrocketed, and the town of Shelton is feeling the effects.
So heroin was here, heroin was a big deal, and then it just seems like it changed from heroin over to fentanyl, and when you went to fentanyl, it became much more lethal, so the overdoses went up.
In 2022, Mason County had the highest opioid deaths per capita of any county in the state. It is also without a permanent opioid treatment clinic that would dispense medication to people trying to come off opioids.
We don't have any clinical space. So a lot of counties are faced with the same sort of problems. You don't have space, you don't have funding, you don't have people.
But what Mason County now has is a mobile treatment unit. Evergreen Treatment Services is a private nonprofit and one of the oldest methadone treatment organizations in the country. Since late December, they have operated in downtown Shelton. 6 days a week, a staff of 8 see patients, some living on the streets who haven't been able to find treatment in other places.
What it allows is for those patients who have the most difficulty accessing those services to be able to have us meet them in their community where they're at, to get established on medication and access other services like counseling, case management, until they stabilize.
I was kind of stunned when they called and said, so we're looking to bring this thing in. Would you have any problem with us parking? No, I don't have a problem with you parking. You'll have to figure that out with the city, where to park. But please, if you come in, be here at least 6 days a week. And they're doing that. They're making sure that they're servicing their clients.
By mid-February, the mobile unit was seeing about 75 patients, Monday through Saturday, dispensing daily doses of medication, most often methadone.
I'm trying to get on methadone so that way I can get off the fentanyl, obviously.
Patients like Lola Savage.
I was using heroin and I used the fentanyl to get off the heroin. So, and I know that sounds like a no-brainer really, but I wasn't knowing exactly what I was getting myself into when I switched to the fentanyl. It's not easy to get off of. I mean, your body aches so bad, the muscle aches. I mean, it's pretty much ruined my life, really.
Savage says the methadone treatments have helped her to no longer crave the fentanyl that was so easy for her to get on the street. And she is grateful the mobile unit is here.
Right now, my car is barely running, so I can drive to Olympia if I had to. And I know that they have services to help you get there, but getting a hold of those services is really difficult.
Methadone has proven to be the gold standard for treatment.
The research does suggest that methadone absolutely provides people the best opportunity to be able to stop using illicit substances.
But the treatment is time-consuming and hard for many patients to access.
The issue is unfortunately, historically, there's been some negative stigma surrounding the level of care that we provide. And so there are communities, even still to this day, that will block or try to stop like methadone clinics from opening up in their communities. Thankfully, it seems like in the last several years, that stigma has started to turn drastically, and I think it's partially because of all of the visible problems that have come from the opioid epidemic in all of our communities.
Some patients will need to be on medications to treat opioid addiction for the rest of their lives. At this point, those who can find treatment and stick with it could be considered the lucky ones.
I've lost quite a few people since I've been doing this that I never expected to lose, so that's the hard part.
When did you have it done?
4 months ago.
As fentanyl continues to kill, Maria Petty knows her work is far from over. She is fielding calls from other parents in Washington state who find her on the internet soon after they lose a child to fentanyl. On the day we visited her in early March, she mentioned 2 mothers who had reached out in just the past 2 weeks. What kind of advice do you give them?
I'm honest. It doesn't get easier. In fact, as time goes on, it gets harder. Finding something that can honor them, even if it's not being out in a public forum. And it's just really getting that message to your kids so that when they go out into this world, they have a chance of coming back home.
The Lucas Petty Act will require opioid education to be included in health and physical education classes by this upcoming school year. Nationwide, fentanyl deaths have increased every year for the past decade. In 2023, for the first time in U.S. history, fatal overdoses peaked at around 112,000 deaths. 4 in 10 Americans personally know someone who has died from an overdose. So what is being done to stop the drug before it enters the U.S. and stop the spread of the deadly drug once it is here? We talked with congressional leaders and also went in depth with the Federal Drug Enforcement Administration for an inside look at the path the drug takes to get to the U.S. At first glance, it's hard to tell exactly what you're looking at. But this picture of an open-air laboratory in Mexico shows the kind of fentanyl labs run by the Sinaloa and Jalisco drug cartels.
When you hear the word lab, you kind of think some sort of pharmaceutical company in a clean environment. The truth of this is, these are just dirty places in the jungle where they're mixing chemicals together to create fentanyl.
It is just one part of the billion-dollar Mexican drug cartel industry that has taken over the production of illicit fentanyl and is responsible for the deaths of hundreds of thousands of Americans.
This crisis is like no crisis I've ever seen in my 26 years with DEA. It's incredibly bad, incredibly dangerous.
David Reams is the special agent in charge of the Seattle field office for the U.S. Drug Enforcement Administration. In his role, he oversees the work of agents in Washington, Alaska, Oregon, and Idaho. Before taking his current job, he spent years working as an agent in border towns like El Paso, Texas, and heading up a drug trafficking task force in St. Louis, Missouri.
The first time I'd really seen fentanyl on the street was probably 5 or 6 years ago. And at that point, the fentanyl was getting mixed into mostly heroin.
The photo of a Mexican cartel's fentanyl lab was taken by the DEA and is a window into how this powerful drug is made for the illicit market. Chemicals are first shipped from China and made into pills by the cartels in Mexico. The pills are then driven across the border into the U.S. Reams explains what happens next.
What we're seeing is sort of a dispatch model almost, where local mid-level traffickers will have ways to communicate with wholesalers. These wholesalers will then contact couriers who move the drugs for them to Washington State.
In cars, trucks?
Mostly cars, mostly passenger cars, but it could be trucks, it could be aircraft, it could be boats, it could be the post office or FedEx or any sort of delivery service. Probably the 80% solution, though, is passenger cars up I-5.
We've become kind of a hub.
It's a path U.S. Congressman Dan Newhouse knows well. Fentanyl overdoses in Yakima County have more than doubled in recent years, and his district in central Washington is becoming a hotspot for the distribution of the drug.
One of the drug cartels have designated one of the communities in central Washington as their national headquarters, which is very, very concerning. Highways feed into central Washington. Drugs come up primarily from the south, from the southern border, make their way into Washington State, and then from some of my communities in my district are distributed throughout the state and throughout the country.
In 2023, Representative Newhouse launched the Central Washington Fentanyl Task Force. The members include law enforcement and medical personnel working on the front lines of the crisis.
A lot of them are doing what they're doing in their own worlds, but maybe are aware, but maybe don't know all the details of what's going on in the other segments of this when people are trying to address this problem.
Thank you to all of our first responders.
The story and the statistics are similar across Washington State.
Responsible for responding to 911.
At a firehouse in Everett, calls come in at the same time as U.S. Senator Patty Murray holds a roundtable discussion on the ravages of fentanyl to this community. In just 3 years here, the amount of naloxone used to reverse opioid overdoses has nearly tripled.
What is clear to me listening to all of this is there is no one single solution. We would all just like these drugs off the streets and not have them come into our country. That's obviously one thing, but we have a lot of people who are addicted who are getting access, so we need treatment, we need help with recovery, we need preventative services, we need folks on the street in these communities who are helping the people one-on-one.
I've been sober for 4.5 years now.
Senator Murray heard from Morgan Webb, a recovering addict who now works with those struggling to get off fentanyl.
I was unhoused for about 3.5 years. I struggled with opiates and methamphetamine, and it was kind of a gradual slide down to that.
Despite her past, Webb considers herself lucky.
I feel like I had it kind of easy. My drug of choice was heroin when I was out there, and just in the last 5 years, heroin doesn't exist anymore, and it's fentanyl. And fentanyl is a lot harder to get off of than heroin. The withdrawal times are longer and they're more severe, but our detox centers and our insurance hasn't really caught up to that. And so the same standard of 3 to 5 days of detox that they were using when I got clean, they're still using now, and it's not effective.
Both Murray and Newhouse say expanding treatment programs and educating people about the dangers of the drug are key to battling this crisis.
People who sell or push drugs, we should absolutely make sure that they are taken off the street, pay a penalty for doing that. For users of drugs, it is an addiction, it is a disease, much like any other disease we have, and we should not be punishing them. That doesn't stop them from using. They need preventative services, and that's why I believe we need to focus on that.
Some of the things that I've learned in this task force of kids as young as 10 and 11 years old are getting involved with fentanyl. That makes my heart cry to hear that. And so we've got a big job to do of educating young people, parents, the entire community as to what's going on here.
In February of 2024, a bipartisan border patrol bill was blocked in the Senate by a conservative bloc of Republican senators who felt the bill didn't go far enough in shutting down the number of illegal crossings each day at the border. The bill was also contentious because it included the issue of aid for Ukraine and Israel. Border Patrol agents supported the measure, which would have paid for more high-tech drug detection machines that could scan more cars for fentanyl coming across the border.
I was so disappointed. We had that in the bill that I wrote that we had on the floor, and the Republicans rejected it.
Representative Newhouse says he wishes the House would have had a chance to vote on the bill.
So I feel like there's a missed opportunity here where we should have, as Congress, stepped up and met the moment, and we dropped the ball on that.
While cities and towns see the impact of a booming drug industry,
fentanyl is in abundance. It's everywhere, it's cheap, it's plentiful, and it's causing so many more overdoses.
Throughout the U.S., DEA agents are seizing pills with stronger potency. A running tally of fentanyl powder and pills confiscated is updated live on the agency's website, with each year's numbers exceeding the previous year's total. Currently, 7 out of 10 pills seized by the DEA have a lethal dose of fentanyl.
Why would the cartels make a lethal dose of fentanyl be the average? Well, the answer is because as consumers get more and more accustomed to taking opioids, their tolerance goes up higher and higher. So they need a stronger dose to get the same effect. The cartels know this, and they're creating a more lethal form of fentanyl to satisfy their customer base.
The Drug Enforcement Administration's work is complicated by social media and drug deals made online.
My communication is encrypted when it leaves my phone, and it comes to you encrypted. So you and I are the only people that have this encryption, so there's no way to intercept it, because only you and I have it. So that's prevalent across the board with social media messaging apps, and that's a problem for us.
Well, there are numerous stories of teenagers ordering drugs on social media and overdosing on fentanyl. We asked both Senator Murray and Representative Newhouse why Congress isn't doing more to hold social media companies responsible.
This is a very complex problem and hard to do, and certainly everyone across the system, from our DOJ officials through our Labor and Human Services, DHS, are trying to say, what is my role, how can I stop it? It is complex and difficult. Doesn't mean we give up. We try and find ways, every way we can, to prevent it.
We're looking at what can be done. Certainly we have freedom of speech issues and things like that we have to be very cognizant of, but there has to be some sense of responsibility for what's allowed on these platforms.
Finally, while adults debate the policy, young people in Washington State and across the nation are doing their part to spread awareness.
Most of the people who are dying from it don't even know that, they're even taking fentanyl.
Students in the Clover Park School District were awarded a $5,000 grant from the Tacoma-Pierce County Health Department to create a series of videos that shared the dangers of fentanyl with their peers. The 4-part video series debuted in March and will run district-wide. Nationwide, teens are speaking out in a video that features the DEA's One Pill Can Kill campaign. High school students in San Bernardino, California used that message to send a warning to other teens about fentanyl.
Fentanyl is a deadly drug that is being made into fake pills and mixed into other drugs to drive addiction.
The video includes the parents of teens and young adults that passed away after unknowingly taking fentanyl. From Washington State, thank you for watching. We hope you'll join us next time on Washington to Washington.